Alright, good afternoon guys, Andy Nyandoya here, and today we are doing a different vlog in Mama Lucy Kibaki Hospital. Alright, good afternoon everyone. Welcome back to my YouTube channel. Andy Nyandoya is my name, and I'm a travel content creator from Nairobi, Kenya, and today I'll be doing a different episode. I'm currently in my country. The city is Nairobi, and today I'll be checking my health. So today we are going for a medical checkup at Mama Lucy Kibaki Hospital, where I'll be doing a echocardiogram, and it's an imaging test done to ascertain the heart structures and function, and this is the machine that will be used to do this. And this is the place where I will lie down for them to do this procedure. This hospital is located in Komarok, Embakasi Central. So welcome. If you're a first-time patient here, the consultation charge is 200 shillings only, and if you are a revisiting patient, the fee is 100 Kenya shillings. That is quite affordable for everyone, and I would suggest you guys to be having a medical checkup even before you get sick. That is a very good thing to do. We should take this initiative of taking care of our health before the health takes care of us. So welcome to my channel, and let's do this. I will take you guys through whatever will be happening, everything, and what information you need, I will let you guys know. So since I am doing this procedure today, the echocardiogram, I'm also advising you who is watching this screen right now to make sure you can just go and have a test of the echocardiogram. And here at Mama Lucy Hospital, they only charge 6,000 Kenya shillings. So welcome to my channel, and let's do this. Health is the first priority. Remember, without a good health, you are totally nothing. So health before wealth, guys. Today I am in this public hospital by the name Mama Lucy Kibaki Hospital, and today we'll be doing a procedure or an echocardiogram, and the people of the world what really happens around echocardiogram procedures. Okay, welcome to my channel. If you have any questions, if you have any comment, let me know in the comment section, because I like reading your comments. So let's do this, guys. Today it's all about health. Let's take care of our health. I want us to always be having mentality of doing medical checkups before we get sick, instead of being sick then rushing to the hospital. I think we can do that. We be going for medical checkups even when we are not sick. That is what I want to encourage the people to do. So welcome to my channel, and let's do this. So guys, when you come to Mama Lucy Kibaki, if you are a first-time patient, you pay consultation fee, which is 200 Kenya shillings. I will let you know how much that is in dollars, because that is the universal currency. And if you are a revisiting patient, you pay 100 shillings. That is quite affordable for us, eh? So echocardiogram is a procedure that is used to check how the heart functions, and if the heart is okay.
And also the valves.
The valves.
Structure, not anatomy. Structure and function.
Structure and function.
That's why it's an ultrasound.
Mm-hmm.
Of the heart.
Mm.
Of the heart.
Oh,
Yeah,
so one of the
right.
doctors tells me that echocardiogram is one of the ultrasound of the heart. It's an image test done to check the
Heart structure and function.
heart structure and function. Very important, guys, very important. Right, so guys, the first thing I'm supposed to do is remove my upper clothes, everything, and then I will lie on this bed, guys. I will lie here, and then they will perform the tests. All right, so allow me to go remove my clothes. We do the medical checkup ASAP. All right, guys, I am ready. Okay.
So this is one image of the heart. It's a view that we're able to see different chambers of the heart, like the left ventricle, the left atrium, and also the right ventricle. We also to evaluate these are the valves, both the mitral valves and the aortic valves. So in this one, we're able to see how the blood flows and be able to take different measurements, like the thickness of the walls of the heart. We're also able to see if there's any regurgitation, that is backflow of blood to the chambers. Yeah, so from here we're able to diagnose various things. Like here we're putting color. This one enables us to see the flow of blood. And if there's any regurgitation, that is backflow of the blood in the valves region, we're able to detect it and also able to quantify it, if it's mild or moderate or severe. So one importance of this echocardiogram, we're able to detect any regurgitation, which means backflow of blood at the valve region. So for example, when we put a color, we're able to see how the blood is flowing through the valves, both at the mitral valve and the aortic valve. So for a case, this is normal, but in case they had any issue on the valve regions, we'll be able to detect any backflow of blood towards the chambers of the heart. But for this case, it's normal. So like here, we're measuring the blood flow across the aortic valve, and this one appears to be normal. So the one importance of doing echo, we're able to see how the blood flows at different areas in the valves. Like for example, this one, you're seeing how the blood is flowing through aortic valve, and it looks normal. But in case there was any issues like narrowing of the valve, we're able to detect using this view. So from this image, we're able to see the tricuspid valve, and when you put the color, we're able to see there's some very mild backflow of blood, which is usually a normal finding. But at the mitral valve, which is this region, when you move the color to this side, it's normal and there's no backflow of blood. Different chambers of the heart, and also we're able to see these two are the mitral valves and the tricuspid valves clearly. And also when we put color, we're able to see how blood flows through the valves, both on the mitral valves and the tricuspid valve. Yeah, and also if there's any regurgitation. So from this image, we're able to see the mitral valve, and there's just very mild backflow of blood. And for this one, you can say it's normal, but in case there's more, if it was a lot, we'll have quantified it. So from this view, we're able to evaluate if there's any thrombus, which is generally just a blood clot. And from our patient here, there's no thrombus formation. And we're also being able to evaluate how the walls thicken. So from here, we're able to evaluate all the chambers of the heart and also the valves. And one way of detecting if there's any backflow of blood is when we put color. And from here, she has just very mild backflow of blood at the tricuspid valve. So we can also be evaluating the blood flow across the mitral valve, which is also minimal. She has very minimal backflow of blood, and that is also a normal finding. Okay, so from this view, we're able to look at the walls of the heart, how they are thickening and how they are contracting, like during pumping blood. And like for our patient here, it's normal, but in case there was an abnormal wall motion, we're able to detect it. So from this image, we're able to look at the walls of the heart. We are seeing how the heart is contracting during diastole and systole. And if in case there was a region of the wall where there was an abnormality, we're able to detect using this view. And from also here, we're able to see the valves. In case there's any vegetation or any calcification, we're able to, but from our patient here, everything looks normal. The valves are normal, and the walls, as you can see, are contracting very well.
Also, tumors and any growth within the cavity can be detected while doing this exam.
And how long should I do this kind of test?
Normally, echo scan takes 45 minutes and 15 minutes of reporting. That's 1 hour you can spend with us here.
No, I meant like how frequent should I be coming for this echo? So doctor, how frequent should I be coming for this echocardiogram test?
Depending on your condition. For example, patient with pressure.
Okay.
Twice a year is advisable.
Okay.
Yeah.
Oh, all right. Anything else apart from pressure?
We have difficulty in breathing. Patient with difficulty in breathing.
Chest pains.
Chest pains.
Oh, chest pains. Okay. So mostly difficulty in breathing and chest pains only.
Yeah.
You need to come for this test.
Test.
Guys, have you heard that?
And also,
Your health comes first. You want to say something?
also patient with chronic illness.
Oh, chronic illness. You need to come for the test. Okay. All right, guys. The test is going for only 5,000 Kenya shillings, right? 6. Sorry, guys. The test is going for only 6,000 Kenya shillings.
Yeah,
You've
in
heard.
And
Here
then-
in Mama Lucy.
And achieve full coverage.
So the test is going for 6,000 Kenya shillings, and if you have NHIF, guys, it's full coverage. Despite if you have not chosen the hospital, the NHIF will cover that. So guys, this is an advantage to you guys. You should come and do the tests. Easy peasy. Something else you were saying, chronic patients, or what did you say?
Yeah, patient with chronic illness, especially the patient with known cancers, they are on treatment, they are on chemo. Patient with issues with the kidneys, all these conditions can strain the heart. It's okay for a patient to be on regular checkup of how the heart is functioning and any abnormality or any changes of the heart that might be affecting by whatever the patient is on.
Thank you so much for that information.
So for this one, she's lying on her back. We're able to evaluate the aorta and the aortic root at this view. In case there's any backflow of blood, or in case of aortic dissection, we're able to detect it. Yes.
Okay.
So how is my heart, doc?
Your heart is good apart from the few palpitations, which is normal.
Okay.
Yeah.
So right now I'm okay.
Yeah, okay.
All right, guys, it was as easy as that. How many minutes did it take us, doc? How many minutes was that? 45
For the
or?
whole exam or
No, for the whole exam.
45 minutes.
45 minutes,
Yeah.
so it's not even much.
Yeah.
So you said you advise people to frequently do the echocardiogram within a range of twice or thrice per year?
Yeah.
Okay. Not more than
You
5
can,
times per
depending
year?
on your condition.
Okay.
Yes.
All right. Is there anything else you'd like to say to the people?
I just advise the people within the community to come and do echo. Yeah.
It is very, very advisable.
Yes.
All right. And what is the main importance? What do you guys detect when you do the echocardiogram? I think I need to let the people know. Personally, I know, but I want you to let the people know once again.
Generally, it's the function of the heart.
Okay.
Yeah.
All right.
And then abnormalities within the heart. Yeah.
In case there is an abnormality in the heart.
We detect using this echo machine and the function of the heart. Yeah.
Tell me about ECG.
It's an ECG is also a part of the echo exam, but
it's not so important.
it's important.
Okay. So you also advise them to do it?
Yeah.
Okay. So does ECG and echocardiogram come together, or they can be done separate
They
times?
can be done separately, but we are advising people to do both.
To do both.
Yeah.
All right. So guys, you've heard what the doctor has said. It is good to frequently do the echocardiogram and ECG. That is 3 or 5 times per year if you have time. It is going for only 6,000 Kenya shillings. I will convert that into dollars for those who don't understand the Kenya shilling currency. And yes, it was amazing to be with you guys here today, and I'm so happy my medical checkup is okay.
It's okay.
All right, you guys come and do it. I'm just done with my report, and here I have received my report. You can see how professional they are, and now it's time to go home. So thank you so much everyone for watching this vlog up to the end. Please consider doing medical checkups for your health, and see you on the next. I appreciate all the doctors who helped me with this today. Thank you so much, and God bless you all. I forgot to tell you guys that this is a level 5 public hospital. Yeah.